In this set of slides, we're going to be looking at the upper cervical spine, both the joints and the ligament structures, specialized ligament structures of the upper cervical spine. So the first joint we're going to look at is the craniovertebral joint, also known as the atlanto-occipital joint. This is the joint between the C1 vertebrae or atlas and the base of the skull, the occiput. It's a condyloid type synovial joint. It's got a concave superior articular facet on the atlas vertebrae on the top of the lateral mass of atlas, and this articulates with the convex surfaces of the two occipital condyles on the base of the skull. The main movement allowed here is flexion and extension, as in nodding yes. The joint structure itself would allow for some lateral flexion and rotation motion, but two ligaments, in particular the alar ligaments and the atlanto-occipital membranes, will markedly limit these secondary movements. So it's mainly flexion and extension with limited lateral flexion and quite limited rotation due to these ligaments. So again, we're looking at the atlanto-occipital joint on the lateral x-ray. The arrows indicate where this joint is located. You can also see here, so this is C1 with the anterior tubercle, posterior tubercle, and then the dens you can see projecting upwards in here against the anterior arch of atlas. And then the much larger spinous processes of C2 behind here, okay, the C2 vertebral body. This is it's a posterior view with the posterior parts of the vertebrae having been cut away in the upper cervical region and the posterior part of the skull having been cut away. So in here you're looking at the anterior surface of the foramen magnum, the basilar part of the occipital bone. This would be the posterior arch of atlas that has been cut away in here, the TVPs of atlas in here, and the body of C2 down below here. The dens is projecting upwards and is being held in place against the anterior arch of atlas by the transverse ligament and the alar ligaments. So this is looking at an anterior on the left and a posterior on the right view of the upper cervical region. In this case, the anterior view on the left here, we're looking then at the anterior arch of atlas in here, the lateral mass on each side, the TVP of atlas, the vertebral body of C2, and you can see that in terms of ligament structures, the whole bony ring of the atlas, there's a membrane which extends from the superior surface of the atlas on the anterior arch up to the inferior surface of the foramen magnum on both anterior and posterior arches, and this ligament structure is known as the atlanto-occipital membrane. And then the joints, the capsule of the atlanto-occipital joint is located immediately posterior to this membrane on this view here. And this is the posterior view, the posterior atlanto-occipital membrane. And another interesting thing you can visualize here is the vertebral artery coming up through the transverse foramina. Comes up through the transverse foramina of C1, and then it turns slightly posteriorly and penetrates through the posterior atlanto-occipital membrane to gain access to the vertebral canal, where it will then run upwards, and it's part of the blood supply to the brain. So again, this is an anterior view with the showing the skull, but the rest of the anterior part of the skull has been cut away here. So this is the occipital bone just at the anterior to the foramen magnum here, the basilar part of the occipital bone, the anterior atlanto-occipital membrane running from anterior arch of atlas and lateral mass upwards to the basilar part of the occipital bone surrounding the anterior foramen magnum. And you can also see in here they've cut away a section of that membrane to show you where the atlanto-occipital capsule and the synovial membrane for the atlanto-occipital joint is located. Probably didn't need to include this slide. The only significant part of this is maybe this upper diagram, which again is a median sagittal section of the upper cervical region. So the posterior part of the occiput, the basilar part of the occiput in here, the anterior portion of the foramen magnum, and then the C1 vertebrae, the posterior tubercle of C1, the anterior tubercle or anterior arch of C1 here, the vertebral body of C2, and the odontoid process of C2 in here. And then some of the ligamentous structures here, the posterior atlanto-occipital membrane. There's a tectorial membrane, which is the continuation of the posterior longitudinal ligament that we're going to be looking at in here. There's a transverse ligament and an apical ligament, all of which we'll look at later. Second joint in the upper cervical region is the atlantoaxial joint between C1 and C2 vertebrae. This joint actually consists of three separate synovial cavities, or three separate synovial joints. It has the two facet joints between the inferior articular processes of C1 and the superior, which is at the bottom of the lateral mass of C1, and the superior articular process of C2. And then in addition to those facet joints, there's a central synovial joint between the dens or the odontoid process of C2, where it's held against the anterior arch of atlas and the transverse ligament of atlas, which hold it in place against the dens in place against the anterior arch of atlas. So these three separate synovial cavities collectively form a pivot-type synovial joint, which is a uniaxial type of joint. It allows rotation motion or a transverse plane movement. And this joint, this one joint, the C1-C2 joint, basically accounts for about half of the total range of rotation in the cervical spine. So this is a superior view looking down from above on the atlas vertebrae and the odontoid process, which is projecting upwards posterior to the anterior arch of atlas. And you can, this is a good illustration of the central synovial joint that forms part of this pivot joint. You can see here the articular cavity between the anterior arch of atlas and the odontoid process. And there's another separate synovial cavity where the transverse ligament surrounds the odontoid on the posterior side. And so there's a synovial cavity that develops between the transverse ligament and the posterior surface of the odontoid. And basically then the atlas vertebrae is pivoting around that odontoid process of the axis, or C2. In addition to the central synovial joint, there are facet joints on either side. This would be, this line down below here would represent the inferior surface of the lateral mass of atlas, and there would be an inferior articular facet on that surface, which then articulates with the superior articular facet of C2. So this is a median sagittal section through the upper cervical region. So this is again the basilar part of the occipital bone in front of the foramen magnum, The C1 level would be represented. This is the anterior arch of atlas. This is the posterior arch of atlas in here. This would be the lamina of C2 and the vertebral body of C2, and of course the dens of C2 coming up posterior to the anterior arch of atlas. And these, it is critical that we maintain or hold the dens or the odontoid process tight against the anterior arch of atlas. You can't allow any significant degree of laxity or flexibility, because if we allow the dens to tip back, it's going to severely damage the cervical spinal cord that's passing behind on its way through the foramen magnum in here. So again, we've got a series of strong ligaments behind the dens which are holding it in place. This thick part is called the transverse ligament, but it also has vertical pieces which attach to it. The superior piece which extends up to the base of the basilar part of the occipital bone, and the inferior piece which extends down and attaches onto the vertebral body of C2. And then posterior to the transverse ligament is the tectorial membrane, which is the continuation of the posterior longitudinal ligament, which is found lower down in the vertebral column. So just to summarize the two joints in the upper cervical region, the atlanto-occipital joint is a joint between the occipital condyles on the base of the skull and the superior articular facets on the upper surface of the lateral mass of the C1 or atlas vertebrae. That joint is a condyloid type synovial joint, but the main movement allowed there is flexion and extension motion, and it has very limited lateral bending as well, but it's mainly a flexion extension motion. Whereas the joint between atlas and axis, C1 and C2, is a pivot type synovial joint. It's got three separate synovial cavities, a facet joint on either side, and then a central synovial joint between the odontoid process and the anterior arch of atlas, and the very strong transverse ligament which helps hold the odontoid process in place against the anterior arch of atlas. And that joint allows a transverse plane motion or a rotation motion between atlas and axis. We mentioned the nuchal ligament previously when we looked at the general vertebral ligaments. So this incorporates parts of the supraspinous ligaments and interspinous ligaments extending up into the cervical region, except it becomes much broader and thicker in an anterior to posterior perspective in the cervical region than it is anywhere else in the spine. And it forms a thick midline partition, which forms a point for muscle insertion and muscle attachment in the cervical region. It resists excessive flexion as a ligament. It resists excessive flexion of the cervical spine, but its equally important feature is that, again, if we flip to the next slide, you can see that it's got considerable depth from an anterior to posterior perspective, extending back from the tip of the spinous processes right back to the base of the dermis in the midline. And this midline partition allows great opportunity for muscle attachment and muscles to take origin off of this tough band of fibrous connective tissue. So that's the ligamentum flava, and again the interspinous ligament and the supraspinous ligament, which are found in the the other parts of the vertebral column become incorporated into or within this ligamentum nuchae. Tectorial membrane is a specialized ligament in the upper cervical region. We mentioned previously when we looked at the posterior longitudinal ligament, which runs along the and attaches to the posterior surface of vertebral bodies within the vertebral canal, that the PLL is considered to end at the C2 vertebral body, and then there's a continuation of that ligament from C2 upwards to the basilar part of the occipital bone at the front of the foramen magnum, and that ligament is known as the tectorial membrane. It resists, as with all of these, pretty much all these ligaments, you could say they resist excessive flexion of the head and neck. So again, in this view, this is a posterior perspective. The posterior parts of the posterior arch of atlas and the lamina of the vertebrae have been, at the pedicles, the vertebral arch has been cut away at the pedicles of C2 and C3 down here to expose the posterior longitudinal ligament attaching to the posterior vertebral bodies in here. And in this case, the membrana or the tectorial membrane has been cut and pulled back to reveal the deeper lying ligaments, the transverse ligament and the alar ligaments, but it again would normally cover these ligaments running from the posterior surface of C2 upwards to the basilar part of the occipital bone in front of the foramen magnum, and it helps hold the dens or the odontoid process, which is in front of these two ligaments, against the anterior arch of atlas. The other thing that's maybe worth outlining where we didn't see it in the other view is this. This shows the articular capsule of the facet joints on either side between C2, this is the body of C2 or the body of axis here, and the lateral mass of atlas, and so this would be the location of the facet joints on either side between axis below and atlas above, and then of course you have the central synovial joint between the dens and the anterior arch of atlas and the transverse ligament behind. Repeat of what we've seen previously with this median sagittal section of the upper cervical region, and again here you can see the posterior longitudinal ligament running along the posterior surface of vertebral bodies. So this would be C3 down here, the body of C2, and then the odontoid process here. And so the post-PLL ends at its attachment to the posterior surface of the body of C2, and then the tectorial membrane continues it above, passing behind the transverse ligament and eventually attaching onto the basilar part of the occipital bone on the inner surface of the foramen magnum. So the term cruciform means cross-shaped, which is exactly the structure of this ligament. This is the ligament that is found directly deep to the tectorial membrane in the upper cervical region, and it has both vertical and transverse portions. The vertical portions are much more slender and weaker, but the vertical portions attach below to the posterior body of C2, and superiorly they attach to the basilar part of the occipital bone at the front of the foramen magnum. The horizontal portions, which are the much stronger, robust part of the ligament, runs from the inner surface of the lateral mass to the inner surface of lateral mass on the other side, and this is what is commonly referred to as a separate ligament structure, the transverse ligament. But it really, technically, should be referred to as the transverse band of the cruciform, because in addition to this this very strong transverse part of the ligament, there is a vertical band connecting to the occiput above and to the posterior vertebral body of C2 below. And so again, this posterior view where we've cut away the posterior arch of atlas and cut the vertebral arch away from the body of axis here to illustrate the transverse ligament. So the tectorial membrane has been cut and pulled back above and below to reveal the very thick, strong transverse band of the cruciform ligament and the vertical bands extending to the body of C2 below and to the basilar part of the occipital bone on the inner surface of the foramen magnum above. Okay, so this whole structure is known as the cruciform, and then the much thicker, stronger transverse part of the ligament is often referred to separately as just the transverse ligament. This kind of grim photograph is obviously a fairly fresh specimen in the upper cervical region. So again, this would be the basilar part of the occipital bone up here, and this would be the transverse ligament, the horizontal band or transverse band here, and vertical bands extending above and below, up to the basilar surface of the occipital bone and to the body of the C2 vertebrae, posterior surface of the body of C2 down here. So the transverse ligament, and again this is just the transverse band of the cruciform ligament that we looked at earlier, runs from the interior surface of the lateral mass on one side to the interior surface of lateral mass on the other side of atlas. It basically surrounds or encloses the dens, and it is lined with synovial membrane that provides lubrication as the atlas and the transverse ligament rotate around the dens. Okay, and obviously as the atlas rotates around the dens, the head moves with it. So it's really atlas and the head, or the cranium, that are rotating around the dens or odontoid process of C2 at that point. So again, we've seen this previously looking at the structure of the pivot joint between C1 and C2, but in particular here, what we want to emphasize is the location of the transverse ligament attached, running from lateral mass to lateral mass. And of course, it does have vertical portions extending superiorly to the basilar part of the occiput and inferiorly down to the posterior body of C2. So this is part of the cruciform ligament. But this transverse division is lined with synovial membrane so that the whole atlas vertebrae can pivot in a rotation motion around the odontoid process of C2. Okay, and this diagram's getting a little bit old hat at this point, but the transverse ligament, again, this is the odontoid, the anterior arch of atlas here, the posterior arch back here, and the transverse ligament is this thick structure, sort of whitish colored structure, running immediately behind the odontoid process, and it serves to hold the odontoid or the dens against the anterior arch of atlas. And it's got vertical divisions as well here. You can see it extending down to the posterior surface of the C2 vertebral body in here, and the superior division extending up to the basilar part of the occiput underneath the tectorial membrane. The alar ligaments are another important ligament in the upper cervical region. They run from the upper surface of the dens on either side of the upper surface of the dens, upward and laterally to the occiput at the lateral margins of the foramen magnum. They serve to check excessive rotation and lateral flexion of the head between the head and the C2 vertebrae. So as we mentioned previously, that the structure of the atlanto-occipital joint between the occiput and C1 would normally allow for considerable lateral flexion and some rotation at that joint. But these quite strong ligaments, along with the tectorial membrane and the atlanto-occipital membranes, limit the motion and quite severely limit the amount of lateral flexion and rotation that can occur at the atlanto-occipital joints. Okay. And again, on this posterior view, so we've got the cruciform ligament, the transverse band of the cruciform and its vertical divisions, and then anterior to this cruciform ligament is the alar ligaments, which run from the upper surface of the odontoid, which would be just about where the cursor is in here, and running from there upwards and laterally to attach to the inner lateral borders of the foramen magnum on either side. Okay, and so these motions check because they're going to check any motion of any significant rotation motion of the head that might occur at the atlanto-occipital joint, and also check any lateral flexion motions that might occur or limit those motions at the atlanto-occipital joints. So this is a deeper view of that last diagram, obviously taken from a German anatomy textbook, but the body of C2 or axis, the dens projecting upwards, the anterior arch of Atlas in here, and then the tectorial membrane has been cut away, the cruciform ligament has been cut away just to show the alar ligaments running upwards from the upper surface of the dens on each side to the inner border of the foramen magnum. And it also illustrates another ligament we're going to look at in a minute, the apical ligament from the tip of the dens up to the inner surface of the anterior foramen magnum. So three important ligaments: the tectorial membrane, the cruciform ligament, and in particular the very strong transverse band of the cruciform, and the alar ligaments all play an important role in maintaining the dens or odontoid process of C2 tight against the anterior arch of Atlas and preventing the dens from displacing posteriorly within the spinal canal, where if it did move posteriorly, it could compress, compromise, even sever the upper cervical spinal cord. And that is in fact what happens with hanging, where you suddenly, the total body weight suddenly and very abruptly creates a moment where which causes the odontoid to sort of be flipped back posteriorly, and it may rupture these ligamentous structures holding it in place against the anterior arch of Atlas, and when it does that, it would severely compress or sever the upper cervical spinal cord with that. So an additional ligament, but one which is much smaller, weaker, and therefore less important in terms of our purposes. So this is not a key ligament. But the apical ligament is a small ligament that runs from the tip of the odontoid upwards to the inner anterior surface of the foramen magnum, and it assists the other three main ligaments, the tectorial membrane, the cruciform, and the alar ligaments, in maintaining the odontoid against the anterior arch of C1. And again, this view, we've talked about the transverse ligament and the vertical bands of the transverse running up to the inner surface of the foramen magnum and down to C2 below. And then in front of the transverse ligament, in the midline, would be the apical ligament. We don't see the alar ligaments here because they are more laterally placed. But this would be the apical ligament in here, running from the tip of the dens upwards to the inner border anterior border of the foramen magnum. And a repeat of this German anatomy diagram. So the body of the dens and body of C2 with the dens projecting upwards from it, showing the alar ligaments on either side, and the midline much thinner and weaker apical ligament. Last of these specialized ligamentous structures in the upper cervical region, the atlanto-occipital membranes. These membranes extend from the anterior and posterior arches of C1 upwards to attach to the anterior and posterior margins of the foramen magnum. So they sort of close off the vertebral canal between the occiput above and C1 below. They help resist excessive movement at the atlanto-occipital joints. And again, as we mentioned, they close in and protect the upper cervical spinal cord within the spinal canal between the occiput and C1. And we've seen this slide previously. This is the anterior view. So again, we're looking at the anterior surface of atlas, the anterior arch of atlas, and the TVPs of atlas, and the anterior atlanto-occipital membrane, and the upwards continuation of the anterior longitudinal ligament overlying it in the midline here. Okay. But this membrane basically extends completely around on the anterior arch and also on the posterior arch, closing in the spinal canal between atlas and occiput above. And this is the posterior view showing those membranes. So again, this is the posterior arch of atlas that we're looking at here, and the posterior atlanto-occipital membrane in here. And again, there's an opening in that posterior atlanto-occipital membrane, as this arrow, crinkly arrow, indicates, where the vertebral artery passes up through the transverse foramina and then turns posteriorly and penetrates through the posterior atlanto-occipital membrane to enter the upper spinal canal, where it proceeds upwards along with the spinal cord to enter the cranial cavity. So this completes this section on looking at the joints and specialized ligaments of the upper cervical region. Key takeaway points here from the first part of this. You need to know the structure of the two upper cervical joints, the atlanto-occipital joint, which is a condyloid type synovial joint, allowing mainly flexion extension motion between the cranium and the C1 vertebrae. And the second joint is the atlantoaxial joint between C1 and C2. That's a pivot type synovial joint, and it actually involves three separate synovial cavities, and it allows rotation motion between C1 and C2, but the head moves with C1. So basically, as we're saying, the atlas rotates, the head rotates along with the atlas in the movement at that joint. And then the important ligament structures to remember here: the nuchal ligament, forming a relatively thick anterior to posterior partition through the cervical spine, and then the three main ligaments that hold the dens against the anterior arch of atlas: the tectorial membrane, the cruciform ligament, and especially the very thick transverse band of the cruciform ligament, and the paired alar ligaments on each side, projecting upwards from the upper lateral surface of the dens. Okay, so those are the key important ligamentous structures that you need to know from this section.